Welcome to another episode of the Wealthy Podcast. I'm your host, Shauna Nyros. Are you curious about all this news about ketamine treatment? Well, today we are welcoming Dr. Anita Sanan, who's an anesthesiologist, but she's also running the ketamine clinic here in Kelowna. Dr. Sanan helps us really unpack why this treatment is so promising for so many people, and yet why stigma is still attached to ketamine treatments. So if you're curious about learning more, you're going to want to listen up. Welcome to the Wealthy Podcast. I am your host, Shauna Nyros, and today it's really going to be a great and very topical, interesting conversation because we are welcoming Dr. Anita Sanan. Dr. Sanan trained and practices medicine as an anesthesiologist, but over the past several years, she has evolved her scope of practice to include an emerging area of treatment that is garnering a lot of interest in both the medical and general population: psychedelic-assisted therapies. Dr. Sanan serves as the medical director at EntheoMed Ketamine Suite here in Kelowna. It's a pioneering clinic that offers ketamine-assisted therapy to treat a variety of mental health conditions, including treatment-resistant depression, PTSD, and chronic pain. Ketamine treatment has been both promising and controversial, and Dr. Sanan is here to help us unpack why. Welcome, Dr. Sanan. May I call you Anita?
Yes, you may.
Awesome. Well, thank you for joining us this morning.
Thank you for having me. It's a privilege.
Yes. We're really excited to talk to you. I'm going to kind of rewind back a little bit before we get into the really meaty topics. We have an opening tradition on the Wealthy Podcast. For many of the people that join us in conversation, they've come to the healing professions or healthcare because of a personal experience or because of a connection, someone in their family being touched by a health crisis. What's your sort of early story? How did you end up coming into the medical helping profession?
Well, always been interested in science, the human body when I was young, but just like many people, I've had a personal health story. So my mom was very ill when I was 11 years old, and she was in hospital for multiple months with cauda-equina syndrome, which is basically when there's compression of the spinal cord and they lose control of their lower limbs and unable to use their bowel and bladder appropriately. And so she was in hospital for about 6 weeks. Obviously, we treat that very differently now than we did 30 years ago, but that was my very first experience with the medical world. And I really saw how the medical illness can affect not just an individual, but a whole family, because I had a younger sister who was 6, and, you know, it really affected all of us. And then that sparked my interest into like, well, what is this big world environment of medicine? What does this encompass? And like I said, I was always interested in science. So that kind of propelled me to follow that path. Also, I'm the eldest child of East Indian immigrants, so I really only had a few choices: either doctor, lawyer, or engineer.
Oh,
so
really?
I chose doctor.
Okay, yeah. Oh, interesting. Was there anybody in your family that was in medicine?
Not a one. So I have no one in my family or my extended family. I'm the first person to actually go through medical school. So I got a lot of questions from all my family members.
I'm sure.
About things I don't actually know much about, but
yeah, well, congratulations. That's pretty
Thanks.
Awesome. And I'm sure your parents are super proud.
Yeah, they are.
Yeah. So as you mentioned, you sort of began your medical career sort of the traditional way in following a path to anesthesiology, which is a crazy specialty. We were just sort of talking about it. What inspired you to pick anesthesiology?
Well, it's interesting, you know, I think in medical school, we don't get a lot of exposure. So it's very hard to choose, and you have to choose early because everything is competitive. So I knew that I like to work with my hands. I like to do procedures. I like physiology. I like pharmacology. And so they all kind of married very well in anesthesia. I also like this kind of, you know, you do something and something happens. So there's an element of control, which is part of my personality. Mm-hmm. So I think I fit into the anesthesia world quite well. It just felt very natural to me. And I'm very happy with the choice I made. I really enjoy my work. I think we're helping people in their most vulnerable moments. People have to put a lot of trust in you. And you have to have an appropriate personality and demeanor in order to endear people to you, to take over their life. Basically, we're taking their lives in our hands at their most critical times. So it's a privilege and an honor to be able to do that and to help people through these terrible times that they're in.
I love how you've articulated that. I've only had surgery twice, and I completely relate to what you're saying about the relationship with the anesthesiologist. So for those that maybe haven't experienced surgery themselves or haven't really given much thought to what anesthesiology is, can you unpack that a little bit? What is it that you're actually doing?
Well, most of our patients are either coming in for a surgical procedure of some sort or require procedural sedation for a procedure to occur. And most people don't want to remember any of that. So we need to be able to ensure that they have a lack of consciousness or they're unconscious for the procedure, that they have appropriate pain control, because obviously if we are cutting things open, that would be very uncomfortable for most people.
Indeed.
So it's not like sleep when people think of like, oh, we're just putting people to sleep. That's an easy way to think about it, because I think it's an easy layman's term, but you're not actually sleeping. You're in a completely altered state of unconsciousness. There's analgesia, so pain relief, amnesia in the brain, so that people don't remember what happened. We take over everything. So respiration we take over. We breathe for you most of the time with an endotracheal tube. We often are managing your hemodynamics, so blood pressure, heart rate, all your vital signs, because obviously they fluctuate with medications, with stimulation, with all the things that happen in a surgical procedure. So those are all managed by us. And then at the end, obviously, we've brought you to a place that you would never be able to go to on your own. And now we have to bring you back to conscious living, pain-free, comfortable, no nausea, in an environment that, you are safe after having a surgical procedure. So it's kind of like, sometimes I liken it to being like a pilot, right? We have to take off, we have to land, and there's a whole process that's happening in the interim, which we're also managing.
Like all sorts of data points, all sorts of little, that's a great analogy. I think about a pilot's cockpit and all the lights and all the buttons and all of the things that have to be monitored in order to maintain flight.
Yes.
Right? Yeah, it's a great analogy. Are people scared?
Most often, yes. There are lots of people who have, for some people, they are looking forward to a procedure, for example, if they're, in pain, chronic pain, and this is going to improve things for them. But a lot of patients are scared, most scared of anesthesia, actually, than the surgery. So that's sometimes interesting.
Totally.
But that our job is to sort of, allay that fear. And we only have a few moments to do it, because you meet us for a few seconds before we take your life in our hands. So really establishing that trust between them and yourself is a really important moment. So sometimes just things like a calm voice, instilling confidence in them, holding their hand, those little gestures, I think help to enable us to really connect with our patients in that short period of time.
Mm-hmm. And certainly here at KGH, I've met 2 anesthesiologists during my 2 surgeries, and then many more outside of that in the capacity of working for the KGH Foundation. And it really is a special team here. And it's a very delicate, I imagine, medical specialty. All of them are, but this one in particular, when you're bringing somebody that close to, a state, that is not conscious, and then having to bring them back, it's so, it can be really scary for people. So having that sense of empathy and the ability to connect with somebody in a very short period of time and assure them that they're being held and watched and that we've got them is such an important thing. So appreciate you bringing light to that, because it's sometimes overlooked in the grand scheme of things.
I think most people have no idea what we do.
I agree. I totally agree. So it's really great to have you here. I want to move into the psychedelic-assisted therapy, because not only are you an anesthesiologist, but you have now kind of moved over into this really interesting new space that is emerging as a very, in some cases, viable treatment for people that are really struggling, particularly with mental illness. So can you first tell me what is psychedelic-assisted therapy?
Sure. So psychedelic-assisted therapy is a broad sort of terminology because there's multiple psychedelics that can be used, but basically not giving psychedelics in isolation. So using a medication as a catalyst, which is a psychedelic or a dissociative anesthetic, that allows us to basically, I liken it to kind of cracking open the nut of the brain. So it acts as a catalyst to sort of open our brains up a little bit, and encourages neuroplasticity, encourages basically our brain's connections to speak to each other a little bit more. So accesses things that we are not able to do that in our conscious living world most of the time. And part of that is because our own egos get in the way and all that kind of thing. So the actual medicine is a psychedelic. That does one component. Once that neuroplasticity occurs in the brain, our brains are very flexible and malleable and open to change. So particularly for people who are in situations like treatment-resistant depression, where they really haven't been able to break out of a rut, allowing that neuroplasticity to occur and then capitalizing on that with psychotherapy, which is the psychotherapy part of the ketamine-assisted psychotherapy, that then can really encourage change in behavior. Whereas on their own, they may not have been able to do that. And that's most people. So same thing with PTSD. So patients who have severe trauma that they cannot move past or cannot they're reliving it and they can't move past that, allowing them to see it from a different perspective in a different light, without their ego in place. And I don't mean ego like, I'm so great.
Yes.
Ego as in like the brain's ego. Being able to move past that and then see things from a different perspective allows patients to then actually make foundational changes in their behavior, so that those things are something they can actually move past or change their behavior so that they're not stuck in the same behaviors anymore. So, just giving people ketamine or just giving people psychedelics and not doing the therapy part is actually doing a disservice to them, because although they might feel better for a period of time because they are taking a drug that will alter their state of consciousness for a period of time, the effects are not lasting and changes can't really be made because we didn't capitalize on that change in the brain. So the psychotherapy is a very necessary component of ketamine-assisted psychotherapy. There are lots of clinics in places like the US that just give people ketamine every couple of weeks, that people feel better, but it's not lasting change, it's not sustainable, and it's also not the best method to actually improve outcomes for people. So we've kind of taken a holistic approach of using ketamine as a medicine and a catalyst, and then capitalizing on that by all the other things that we do. So mindfulness, meditation, psychotherapy, all those things, to some people might sound kind of hokey, but they really do have evidence-based, they are actually evidence-based. They do actually improve patients' outcomes.
And so there's, my understanding is there's a number of different psychedelics that can be used in these kinds of therapies. You focus on ketamine, but there's also, I've heard of magic mushrooms, but I don't think they're called that. No, psilocybin. Yes. I grew up in Langley. There's a lot of those growing in fields, but different, obviously, than what you're using. And also, ayahuasca, is that one of them as well? Yeah. So you focus on ketamine. Mm-hmm. And if I loved your, sort of cockpit analysis, what does ketamine do to the brain in the simplest terms? Like, does it open doors? Does it flick on lights? Kind
of. So, it's interesting because you did mention all these other psychedelics, so psilocybin being one of them. The thing that's interesting about ketamine is it works from a completely different mechanism. So SSRIs and SNRIs, which are the monoamines that people get as pill form, that they take for antidepressant medication, Psilocybin is also serotonin based. So
same
kind of mechanism. So we're working on serotonin. Ketamine works on glutamate in the brain, which is a completely different neurotransmitter that none of these other medications or psychedelics work on. And the interesting thing about glutamate is that glutamate and GABA are excitatory and inhibitory interneurons that are in the brain, or neurotransmitters that are in the brain, and they encompass about 80% of the neurotransmitters in the brain.
So only 20% are something other than these.
Correct. So all the things that we're doing with monoamines, like serotonin-based medications, are only targeting 20% of the neurotransmitters in the brain.
And that would be your classic antidepressants.
Correct. So exactly. So when we look at ketamine, we're targeting a much bigger component of the brain. Mm-hmm. And it also, by working through a different mechanism, also acts completely differently and independently. So you can still be on your serotonergic medications and then still use ketamine because it's working from a completely different mechanism.
I see.
Because it's targeting 80% of the neurotransmitters in the brain, the effects are so rapid. So, people feel relief within hours to days. So that is a big difference than when we look at our traditional antidepressants that takes weeks to months to work. And then, ketamine is easily available and accessible. So different than some of the other psilocybin or MDMA, which do show some promising results in studies. Mm-hmm. But those are currently considered, not a legal substance. So they're difficult to access. You can get psilocybin through a special access program through the Canadian government, but it does require, people to meet certain criteria. They have to be either at end of life, anxiety, they failed all other modalities, et cetera, et cetera. Ketamine is something that we use every day in the operating room, so I'm very familiar with it as an anesthesiologist. Easily accessible, and the actual duration of action of the medication is also short, so it's easy to administer to people in a reasonable way, whereas psilocybin's half-life is about 6 hours, so it's a very long experience, whereas ketamine is a lot shorter. So for people to actually be able to have an experience, go home, do the psychotherapy, all those things, ketamine is definitely the most accessible, and it also has the most evidence. So it's been the most studied. It's a very high safety profile. So it definitely has the best evidence for depression and PTSD at this point in time. That may change as time goes on and more studies are being done. But currently, I think ketamine has been reviewed multiple times and has the best support for it.
I love how you've also explained that it can't be used in isolation and that there has to be the psychotherapy component to that. Mm-hmm. So if we look at our analogy of like opening the doors and flicking on the lights or whatever it is, it's like those will close again or Correct. Turn off without the behavioral or psychotherapeutic interventions that also, like, tell me about what you do. Like, let's say I'm a patient.
Yeah.
Like, walk me through this. I'm coming to you. Let's say I have treatment-resistant depression. So what is treatment-resistant depression first? And then what happens? Hello, help me. Right. What happens?
So I'll go back just for 1 second about you talking about turning on the lights, flicking on the lights, opening the doors. That there's a window of opportunity with ketamine, because what happens in the brain is when ketamine acts on these receptors, we get this thing called a glutamate surge. Okay, so a surge happens in the brain. That surge kind of only lasts for about 48 to 72 hours. So that's the window of opportunity in the brain where the brain is flexible and malleable, where that neuroplasticity is happening. And you're right. If you don't do anything during that time, you'll feel good. You might be able to kind of, feel a little bit better. But then after that 48, 72 hours, that surge is gone and that window of opportunity disappears. So that's why the psychotherapy has to really occur within that window, because we're trying to capitalize on that time of the glutamate surge when the brain is most malleable. So what happens if you would like to actually how do you get to us? How do you get ketamine assisted therapy?
Yeah. And first, I know for me, I have a person in my life that has had an experience with ketamine treatment, a positive one, but came to it from the, treatment-resistant depression side. Mm-hmm. So what is that?
So treatment-resistant depression, by definition, means that you failed at least 2 modalities of treatment. So sometimes it can be failing a medication, failing therapy, and I don't want to say failing as in like you have failed, but just did not receive the outcomes. It's not working. Yeah, it's not working. You're not feeling better. It's not improving things for you. Sadly, the truth is we don't have a lot of great options for mental health and depression. So people who use SSRIs, the success rate's only about 30 to 40% that people get relief. And when you combine that with CBT, it maybe goes up to 50% of people that actually get improvement. Look at people 1 year out of CBT plus SSRIs, relapse rate is over 50%.
What is CBT? Cognitive
behavioral therapy. So psychotherapy, yeah.
Okay.
So those things work for some people, but they definitely don't work for everyone. And so we have a high attrition rate where people either stop using their medications, stop going to therapy because they didn't find that it was beneficial. So those people are by definition harder to treat, and that's why they're called treatment resistant. And ketamine actually works in 70% of those people. So 7 out of 10 people will have a response to ketamine, even though they have not had a response to many other things. There are obviously 3 in 10 people who won't respond, and we don't know why that is. And the only way to know is to try. But, that's actually a huge number when we think about it, because by definition, these are people who are difficult and have failed multiple other modalities.
And probably pretty desperate to find relief.
Exactly. So, 70% success rate is pretty darn good for anything in medicine currently, actually.
Absolutely.
So people come to us, you can't just walk in the door and knock on the door and ask for ketamine. So you have to have a referral to come to our clinic. So either through a family doctor, nurse practitioner, some naturopaths are referring patients. So they have to have a referral pathway. And we have our forms on our website, et cetera, that our physicians will fill out. And then once they're referred, we actually assess each patient individually. So they get a medical assessment to ensure that they are physically and medically safe to have ketamine. They get a psychiatric assessment, because just because you have depression doesn't necessarily mean that you are a good fit for this program. Because again, people have to have a good family support in their life to be able to continue getting ketamine therapy. It's not a one and done treatment. They have to have multiple visits. So they have to have some things in place to ensure that they're appropriate candidates. So all our patients are evaluated individually first before they're approved for treatment. And then we have a team that basically meets. We have a psychiatrist, a psychiatric nurse, myself, who oversee all of the patients to ensure that they're appropriate for treatment. And then when decisions are made, then we have a lot of preoperative integration for these, pre-procedural integration for these patients. So they have access to a lot of resources on our website. That's part of things like, again, learning about mindfulness, meditation, how to prepare for their session. And then they meet with their psychotherapist before, so that they can intention set, they can set goals, they can have an understanding of what the process will be like. And then they'll come for their first medicine session, which... Do you want me to go into that?
Yes.
Okay.
Well, first, maybe, why is it important to have an intention or set goals coming into the medicine? What do you call it? A medicine session?
Yeah.
A medicine session.
Yeah. Part of it is because, patients who have a lot of trauma or who've had negative experiences that they want to come to the forefront and deal with. By setting those intentions, those thoughts might appear during the time of their actual medicine session. And it's important, I think, for patients to come in with some mindfulness and being open to the procedure. So they have to kind of really be willing to accept whatever is going to come. A lot of patients have things that they specifically want to deal with, like, I want to be better to myself. I want to learn how to be kinder to myself. I want to perhaps learn to deal with some of these, small T traumas that we call them. Other people have had, big traumas in their lives, like been to war or have had sexual assault or other things that have happened to them. And their intentions might be to be able to accept that those things happened and move past them. So, their therapist really works with them a lot and that pre-procedural intention is really, really important, because setting that goal helps to sort of formulate where that ketamine treatment is going to go. And then that's what they also use for their post-session.
Interestingly, I don't even know if this is going to be useful or helpful, but I'll share it anyway. I have a little bit of experience with intention setting from my yoga teacher background. However, I used to explain it to my students in the way that sort of like the 11-11 phenomena, right? So where 11-11 probably doesn't come up any more frequently. Somebody's probably going to argue with me on this one than like 11-12 or 10-52.
Right.
But the fact is that once you recognize that and name it, right? Like, ooh, look, it's a pattern or whatever. Then you start to see that over and over again. And I imagine it's kind of a similar mechanism with the intention setting, is that when you name it, when you call it up and say, this is what I want to do, then when you go into this medically assisted experience, it's at the sort of like surface of your
it's at the forefront
awareness. Yeah. Okay. So we've set our intention.
Okay.
And now what is happening? What are we doing?
Now you'll come for a medicine session. Okay. So this is an actual ketamine therapy or ketamine medicine session. So we have a clinic that they come to. Their vital signs are taken. Patients are weighed. They are put in a medical grade kind of reclining chair. They have an eye mask and some noise canceling headphones because, again, ketamine is a very inward journey. So we want to block out all external stimuli so that the patients can really, get into their own heads. The headphones are connected to specially curated music and playlists that's appropriate for the journey. So kind of slow as the onset occurs, maybe a little bit more intense as things go on. And they can choose, certain types of playlists that if they want something that sounds healing or something that sounds stimulating. It's up to them. And then basically they're injected by myself. So we'd give them an intramuscular injection of ketamine. It's dosed appropriately. And depending on how far they are in their journey, first visit, second visit, third visit, we change our dose. And then basically there's a nurse that's there the entire time. They're monitored with blood pressure cuff and pulse oximeter throughout the entire treatment. And I'm on site. And then they are usually, tell them bum in chairs about 2 hours. So the experience is about an hour and a half. And then we let them kind of recover and come out of it. And then they sit in our recovery room until that's done. We don't do any real talk therapy unless the patient wants to talk at this point, because again, a lot has happened for them in their minds. And so trying to unpack it immediately while they're still kind of recovering from the effects isn't really helpful, hasn't been proven to be helpful. So mostly we just sit and provide a safe, supportive space for them. They're picked up because you can't drive home because you're considered incapacitated.
Sure.
And then that evening they're told basically to journal, be calm, restful, they might be very sleepy. And then they'll have a post-ketamine therapy session within the next 48 hours. Our nurses do call them the next morning just to make sure that there's no complications or issues.
Right.
And then they'll have their therapy session with their psychotherapist, in which they will then unpack all the things that have come up.
Okay. Yeah. Okay. So I know that we're, making sort of imagining, excuse me, I've heard about what happens while in those experiences. Are you able to share a little bit about what a patient might experience?
Sure. Yeah. So everyone's different. Some people will experience light. They might see visualizations and colors. Some people feel very light inside, like unburdened. There is a dissociative effect. So a lot of people will feel like they're outside of their body and kind of looking in on themselves. Some people might go back and relive experiences. Other people might experience darkness. So I have had lots of patients who were like, well, everything was black and dark and I felt like I was falling off a mountain and things like that. And again, that depends on what you came to the session with. So what kind of pre-existing trauma did you have? What's your background? All those things. What's coming to the surface and the forefront is obviously what's manifesting itself as what's been part of your intention or what's been in your mind. All the things that come to the surface, though, we tell all our patients, these were necessary, these are important, it means something to you. And even if it's scary, like people are always worried about going into what the quote unquote K-hole, even if the things are scary, they're in a safe, supportive environment. So they're always cared for. They're never a risk that they're going to get to a point where they're, really uncomfortable. And if they did, we have medications to rescue them from that. So it's always a safe environment for them. So even if negative thoughts come to the surface, they're able to deal with them. But it's different for every person. Mm-hmm. And as we dose escalate as well, the experience changes for them, becomes sometimes a bit more intense. Often the first experience is a little bit lighter because most patients have never had ketamine before and are naive to ketamine. So in order to ease them into it and not go into the proverbial K-hole, we start slow and then we increase dose gradually because ketamine is not a one and done treatment. Most patients need multiple treatments.
And I imagine the first one, there's a little more anxiety because you don't know what to
people
expect.
Are apprehensive,
right? And then subsequent treatments, you don't have that layered on your awareness, you know what to expect. And so then the experience would be different.
Yes. And I think people are a little bit feel more free in the subsequent experiences, where in the initial one, they're kind of still holding on to that control because they've got anxiety about how this is going to go, what's going to happen. But once they've gone through one, then they know what to expect. And I think that apprehension disappears a little bit.
Okay. Well, I have to ask, what's a K-hole?
So a K-hole is when you have a ketamine experience that goes very dark and deep into places where you see things that you don't want to see, or that bring you fear and anxiety, paranoia. This does happen when people do ketamine recreationally, like in a friend's basement without a supportive environment.
Right.
There is that risk of having a really negative experience where, it doesn't end until the medicine wears away.
Got it. Okay.
So they're sort of stuck in this negative experience, fearful experience for a prolonged period of time until the medicine goes away.
And how long is that? Like an hour? Is it an hour and a bit, or does it take longer to?
It also depends on dose, but most likely, about a couple of hours.
Right. Okay. Yeah. Interesting. How do you? Are you able to share? Does that happen at your clinic often? It sounds like you have a lot of safety nets in place.
Yeah. So I would say extremely rare.
Right.
I probably have not had one experience of a patient that I had to rescue so far.
That's amazing.
But yes, you do, people will report having some negative thoughts or negative feelings. But again, like I said, it's all controlled. So it's not like feeling this anxiety or fear or stress in an uncontrolled situation or an uncontrolled environment where then that fear begets fear. This is in a very safe, different environment where they feel, even if negative thoughts come to the surface, they might reach out a hand, and our nurses are there. They provide support, comfort, and then you can get patients through that.
And I've heard your staff is amazing.
They are wonderful.
Yeah.
Yes.
Yeah. Extremely empathetic and very patient and very calming. And I think that really does probably support, because I mean, not to get too deep into the sort of psychotherapy aspect of it, because I know that's not necessarily your area, but I imagine fear is like a big hurdle for a lot of people. I mean, that it could be sort of the block that's in the way. Right. So it makes sense that would come up, and that you have to
jump through it.
Experience that in order to break through that barrier.
Exactly.
Yeah.
But when that does happen, it's an amazing and beautiful thing, right? To see people conquer those anxieties and those fears. And, when I started this clinic a couple of years ago, even, I had obviously thoughts that this would be a successful treatment for people, but I am pleasantly surprised by how well people have done. Actually, it's actually blown my own mind. I'm amazed at what a couple of sessions of ketamine, how it can change people, how their personalities have changed, where I find them unrecognizable at their next visit. They're completely different people. Their families comment on how they're different people. They are doing things that they haven't done in years. And I just think, wow, is this from ketamine? That's amazing.
Yeah. And I think probably, like you said, it's like certainly the catalyst, right? It's like you open the doors, you turn on the lights, but you have to recognize that those other therapies have to play a role, because there's a lot of work to do by patients themselves. Do you call them patients? Yeah, patients themselves, in order to have that life-changing experience.
And that's why patient selection is so important. Not every person can have
ketamine. Like you can't just show up and be like, just give me the treatment. I don't want to do the rest of the work. Like I don't want to talk about things. Like you have to kind of...
You have to buy in.
You got to buy in.
It's an all in, and if you're not willing to do the work, you're not going to have a successful outcome, and then it's just a waste. So we really select and choose our patients very carefully. So, not everyone that comes through our doors is a candidate or is capable of handling ketamine therapy. So really, that's a really important component of our entire program is patient selection.
I am so happy that you shared that this is working for people, and it's changing people's lives and the trajectory of their lives. And for those folks that are suffering with severe PTSD, chronic pain, which is debilitating, especially, the nature of chronic, right? Year after year after year, or as we've been talking about, treatment-resistant depression, they are sometimes kind of at their last straw. And so in that case, this is really saving people's lives and families. As you said, it's not just the person who's in it, it's everybody who's around them. So it's really promising to hear that we're starting to open up our own mindset in the medical community, the health community, to say, all right, there's something here, and it's helping people. But this, I'm going to go there. This treatment has come with its fair share of controversy. Even just in the last few days, we're starting to learn about a very well-known celebrity. It's being reported, passed away, and his death was, all over the media. And now it's being reported that it was because of a misuse of ketamine therapy. Right. I would love to give you the opportunity to talk about that situation, and other situations like that have caused there to be so much stigma around ketamine therapy.
Well, I think, this is obviously a very unfortunate circumstance. Ketamine, like any medication, has the potential to help or harm. It depends on how it is used, how it's administered. It underscores the fact that ketamine has risks. It has the potential to harm people. And so really highlights the need for it to be administered in a controlled, medically supervised environment. So a lot of issues with the celebrity death recently. I have kind of done a deep dive, obviously, into the news and reading a lot of articles about it. So big problems were that this was administered not in a clinical environment, so being given in the back of a car, being given at home by non-medical people, no supervision, no oversight, no monitoring. Huge doses. So, he procured over 40 vials in 1 month of ketamine. So I can't even imagine. It's a preposterous amount of ketamine.
And what would be a normal, but like an average?
I've been doing this for 2 years. I've done over 250 treatments, and I'm on vial number 38.
Oh, wow.
So it's a preposterous amount of ketamine. I can't even imagine. It's general anesthesia levels. And obviously, as most of us know, no one should be getting general anesthesia outside of a hospital type of environment. So he's basically been being administered these super high doses and not being supervised medically at all. And dosing is very, very important, because the goal for you to actually sort of crack open that nut and encourage neuroplasticity is not to be in a general anesthetic level dose. The goal is actually to be in an altered level of consciousness, but not unconscious. Right. Because that defeats the purpose. Then it's just a drug like any other drug, giving you dissociation. It's actually not, encouraging neuroplasticity or allowing changes to occur in the brain that we can then capitalize. It's a whole completely different.
It's almost like you said, it's like just another drug.
It's just another drug. So that, the dosing is really important. That was the problem. There was obviously no integration, no post-care, no follow-up with psychotherapy. That was missing. And it was an abuse of a patient-physician relationship. So people were putting obviously profits and capitalized profits over the well-being of someone who clearly has an addiction issue, and unfortunately being enabled by people willing to feed off of that for financial gain. So there's a lot of things that were completely inappropriate with this outcome, but it highlights the fact that ketamine has risks. Risk of addiction to ketamine after having therapeutic ketamine is extremely, extremely rare. This is actually, this is the only case report that's ever been documented in an actual journal or case report way. So there's not been any other case reports of patients converting from therapeutic doses of ketamine under medical supervision to then going on to use recreational ketamine.
Right, which is called Special K.
Right. So lots of people do use recreational ketamine.
I know this, yeah.
But the conversion from a therapeutic to recreational use is completely uncommon, very unheard of.
Right.
Obviously, this case, there was. And he did... he has some addiction issues that probably needed to be addressed,
right?
Prior to really going on down this path or this route. So it's very unfortunate, but it underscores and highlights the fact that ketamine needs to be administered in a medically safe therapeutic context with a holistic approach to that therapy. There needs to be medical supervision at all times. Dosing needs to be appropriate and individualized per patient because everyone comes with different medical histories, traumatic histories, and that influences our dosing. And it needs to have follow-up and aftercare to maximize the benefits of ketamine and minimize the risks. But every drug has the potential to harm and help. Like I use fentanyl in my practice in anesthesia every day. All we hear about fentanyl are negative and terrible things because we know it as a recreational drug and what the outcomes are for people who use it on the streets. But that being said, in a hospital environment, fentanyl is an extremely important and very useful medication that helps us keep people safe, helps them be pain-free for surgical procedures or post-operatively. So, again, each drug, any drug has that potential to be beneficial or to be harmful. Everything that occurs in the context of that use will determine what the outcomes are.
Why do you think, I always knew as soon as I found out what you were up to, that I wanted to have you on this podcast. How do your peers feel about you? I'm sorry, this question wasn't on the list, but I just feel like part of what we are curious about on this podcast is, there's I'll call it traditional medicine. Or Western-based medicine. Yep. And then there's all kinds of other modalities, some of them very old and some of them emerging. And I would call this one of them. And we're sort of trying to figure out as a health community how to deal with all of this and how to integrate. It's not integrated, certainly not from a funding perspective.
Correct.
Right? And we can talk about that. But what do your peers think about this little side thing you got going on?
I think when I started it a couple of years ago, my colleagues thought I was nuts. Yeah. Because, what are you doing out there? You're just getting people high or are you just administering drugs to people willy-nilly? And, that's fair because there's a lack of education and knowledge. And we are all busy in our lives, so we're not going to educate ourselves on every new thing that comes about unless we have a personal vested interest, right? Yeah. And so part of the problem in the medical community is everyone's tired, everyone's burnt out. They're not really interested in going and doing deep dives into every new thing that comes out. Right. So education is key. I do a lot of talks to family doctors, to my colleagues. I've done lots of medical rounds for my own colleagues where I presented the evidence. And at the end, everyone was like, maybe this does work.
Yeah, because exactly.
The evidence now is actually overwhelming. But if you haven't read the articles, there's no way for you to know that. Or if you haven't done a deep dive into the research, there's no way to know that. So you rely.
Or if they're just hearing the news reports that, this particular celebrity died from ketamine. Oh, well,
Yeah. Exactly. So I think, education is a key component. And part of that is that you have to have people who are willing to educate others, who have a vested interest in this therapy. Even myself, when I first started this, I wasn't sure 100% that the outcomes would be good and that this actually worked. But now it's irrefutable. Right. So, as time goes on, and more research comes out, because again, the research really started on this in the early 2000s. And the first studies only had 7 patients and then 12 patients. So the numbers are so tiny that you really couldn't draw very good conclusions from them. But now we've got really quite profound studies with big numbers, lots of reviewed articles that have looked at multiple different papers and multiple studies that have come out that show that the evidence is irrefutable. And I think, even things have changed. We think things haven't changed, but they have. We're doing ketamine therapy in this hospital currently, which a year or two ago, I would have thought was not possible. But here we are. So we have our psychiatrists have embraced this. Some of them that have embraced this because, again, looking at the evidence and looking at outcomes, there is benefit. And the risk of harm is low because it's a very safe medication. There's just recently been, part of why I even started this initially was as an anesthesiologist, we do ECT, which is electroconvulsive therapy. Okay. So this is a very resource-intensive thing that we do for patients with extreme depression, severe treatment-resistant depression, or catatonia, things like that.
What is it? What do you?
So it's shock therapy.
What it sounds like.
It's exactly what it sounds like. Okay. But these patients need general anesthesia. They need to be admitted for the morning until they recover. They need a psychiatrist to administer the ECT. They need 2 recovery room nurses to monitor them afterwards. They need a recovery room space. It's very, very labor intensive.
Right.
And it hasn't changed in years.
Right.
So, I was kept thinking like, there has to be a better way than this. And so now there's just recently a study looking at ketamine versus ECT in a non-inferiority study, meaning they were looking to see, is ketamine just as good as ECT? Yeah. And the results in the New England Journal of Medicine actually showed that ketamine was better than ECT.
Right.
So I think, there will be a paradigm shift. There is a transition. There will still be a need for ECT, but if we can offload the system a little bit by providing patients with ketamine in an outpatient setting, and they get just as good results, if not better, than ECT, then hopefully that changes things. Mm-hmm. But again, it requires buy-in from a lot of people.
Mm-hmm. And have you felt a little bit of resistance from your colleagues, or are they, once they are they open enough for you to say, hey, listen, I can share with you my experience with this?
Yeah. So I think people are more open than they were before.
Yeah,
and
great.
Definitely I would say a lot of the change I've seen is actually from patients educating their providers themselves. Yes. So most of my patients ask their GP to refer them for ketamine, and their family doctor may have no idea what ketamine therapy is. They might think that their patients are like, out to lunch. What are you doing? Why do you want to do this? Mm-hmm. And then they'll refer them, and the patients come back and there's a change. And then they start referring more patients, because then they say, I actually witnessed this firsthand. And sometimes that's what it takes, right? Sometimes you have to see it with your own eyes for you to believe it. And then you might change your practice. So I have seen a lot of that. I've seen some subsequent referrals from the same physician who initially was resistant because didn't know. Didn't understand, didn't think it worked. Yeah. And then after having a few patients go through, change their mind. So the shift is coming. It's slow.
Yes.
But I think it is coming.
Yeah. It's very, I'm happy to hear you say that. So unfortunately, this is not covered by Correct. MSP. Mm-hmm. And I think we just can be totally transparent. What is a patient looking at for the cost of this kind of treatment? Right.
So their initial treatment is $1,700 because they do have to go through a psychiatric assessment and a medical assessment and be reviewed. So that chunk comes at the beginning, and then each subsequent treatment is $1,400.
Right.
But it does include that pre-therapy and the post-counseling as well as the medicine session. Patients can get to a point when they're had a number of treatments. So normally we stack our treatments at the beginning because the evidence shows that has the best outcome, because you get that glutamate surge kind of compounding on top of each other. So usually between 2 to 4 treatments stacked on top of each other, like maybe a week apart or a few days apart, depending on what patients can do. And then we take a little break, and then they might come back for maintenance treatments sort of every 3 months, maybe 6 months. And those sometimes can be done without all that psychotherapy component.
Right.
So then that comes at a lower cost to them.
Totally. Yeah. It's just another, I like having this conversation, the sort of real conversation about what the cost is to the patient. But again, there's this cost benefit analysis that has to be done. And I know that not everybody has, just extra thousands of dollars sitting around. We had a practitioner on a couple of weeks ago, and she talked about like this, I don't know. I mean, I think it's more common than maybe even I know about, but saving for medical or health, what is it called? It's like medical insurance, health insurance.
Right.
It's kind of like a fund that you, much like you would do, say, for your kids' education fund, right. But you put money away, proactively, so that in the event that you do have to pay for services, because not everything is covered by MSP.
Correct. Yes.
And a lot of these really exciting emerging treatments are not covered by MSP. And we have a beautiful theoretical system in Canada that says we will pay for your health care, right. but that's just not the case.
Yes.
And so it's just another case point to be made, to think about, for all of us to think about our overall health and the importance of that in our life. So when we're looking at something like this, an alternative therapy, we're in that place of treatment-resistant depression. We've tried everything, and now there's this potential treatment available to us, but it comes with a price tag. Maybe, evaluating how we're saving and spending our money, and again, the cost-benefit analysis of that. And this is not to diminish people's very real economic and financial barriers. It's just that I think sometimes, especially in North American, I'm not going to go on a tangent here, but like just the way we live culturally in North America, there's just like, sometimes we focus our energy and our finances on things and forget that health is wealth.
Right. It's
right?
Totally true.
It's like, if you don't have it, what do you have? You can't even enjoy the other things in life.
Well, and I think, there needs to be a step up in government funding for this and in
I agree.
Insurance funding. So insurance will cover, for some of our patients, will cover the psychotherapy component of our
because
treatment.
Your psychotherapists are registered.
Yes. So some of our treatments do get covered for that, but the actual medicine session for the ketamine does not get covered. We have had some coverage through Veterans Affairs, so patients who have severe PTSD that are war veterans are able to get some coverage from that. And sometimes through RCMP or first responders, there has been some interest in that as well. And obviously, those are some of the people we need to help the most, because these first responders, healthcare workers who have seen terrible trauma are the most likely to benefit from it. So there's a program out in Nanaimo that just does first responders and healthcare workers and treats them with ketamine in a group therapy session or group therapy model, and their results have had basically 90% reduction in depression. Most of their patients no longer qualify or meet the criteria for PTSD after a 12-week program, and they had over 96 patients in that treatment group. So the evidence, again, like I said, is there. The insurance coverage would be cost-benefit analysis-wise would be beneficial to most insurance companies, because it costs a lot to pay for people not being at work. It costs a lot for long-term disability or short-term disability, which most of these patients who have severe trauma and severe PTSD, they can't work. And so getting people back to work is a huge savings to the system in general. There was just recently a study done by one of the psychiatric physicians here that looked at that cost of being out of work, return to work, and how insurance companies should actually be providing some funds for these treatments, because the onset time is so short, treatment is so fast, results are quick, that, instead of we pay for something that works about 30% of the time. Psychotherapy on its own only works about 40 to 50% of the time, and they take weeks to months to have effect. So
somebody is presumably could be off work.
Yeah, for weeks to months. Yeah. Whereas, with ketamine therapy, they may be back to work in a much shorter time period. So again, sometimes, even though we think it's very logical, it's hard to convince the powers that be. Well,
and I think too, like we have established this process or a protocol around funding mechanisms where there has to be proof, there has to be evidence, there has to be science. And I think that's important for sure. But with some of these emerging treatments,
right,
there's also just people that need help,
right,
and don't have time to wait for the studies and the reports and all of that. And I know that these are safety nets that we have in place to make sure that people aren't able to go rogue and administer, treatments that are unsafe. But in this particular case, where there is emerging evidence and more data showing that it does work and it is safe. I agree. I think.
Yeah. And ketamine's been around since the 1970s in practice. So it has a very broad safety profile. The other psychedelics are emerging, and maybe those are not the ones that need to be covered at this point in time, because the evidence just isn't quite as robust. But ketamine definitely has very profound evidence showing that it does work.
And I do appreciate that it's being administered, particularly in the case we're talking about right now, like in your clinics, in a clinical environment.
Yes.
It's not being done in a tent in Peru, which is not to say that isn't great and it doesn't work. But, you know,
Yeah.
this is in a clinical environment, very safe. You know, you're an anesthesiologist. So yeah, let's put it out there.
Yeah.
And I think conversations like this do help because as you said too, you know, one of the byproducts, I think, of the last couple of years and the emergence of social media as a platform for sharing information, sometimes good, sometimes not, and having these conversations, one of the byproducts is that people have the opportunity to be more empowered with information than they ever have before. So they can go to their physician and say, listen, I heard this podcast and there was this lady and she was talking about ketamine and I am curious about this, you know, and at least we have that entry point now. I really want to ask you why you decided to do this. Like, because, you know, I mean, you went to school, you're an anesthesiologist, pretty decent job, lots of hours. I mean, like, you know, I feel like there's like no lack of opportunity to work here at KGH,
very true.
right? You know, lots of people getting surgeries and all that stuff. Like, why this?
You know, I think there's a number of reasons, actually. Partly, I came out of COVID, et cetera, like everyone else, burnt out from working a lot in a hospital-based environment with sort of this feeling of lack of control over really anything. So that was part one. Part two is I had this interest in ketamine because I use it in my practice every day, but I'd kind of looked at what was happening in the US. There were these ketamine clinics that were opening. Kind of was like, it piqued my interest. What is this? And then obviously, you know, with mental illness, we have had no profound improvements or breakthroughs in the last number of years. So this is one of the biggest breakthroughs that has occurred. And I thought, well, nobody's doing that here, and maybe this can actually help people. And I help people every day in a different way. But this gives me a completely different aspect of helping people. You know, unfortunately, as an anesthesiologist, you don't really get to connect a lot with your patients long term because you don't see them again.
Yeah.
So, you know, following patients over a period of time, seeing changes that occur, that's not something that I ever was privy to just because of the work that I do. So this is a completely different relationship with my patients. And I get to see them change and grow. And honestly, that gave me so much profound joy, more than I expected, because I get a lot of joy out of my work in anesthesia. And I kind of thought that was it. And that would be enough for me. But some of my best moments and my best work in the last few years has actually been in my ketamine clinic, seeing people who, you know, were on tons of pain medications, now getting married, not on any pain medications anymore. I have people who, you know, never left their home, and then 6 months later traveled to Japan by themselves.
Amazing.
So these profound changes that I actually got to experience with my patients was really powerful for me. And so that just kind of fueled me and propelled me to push forward on this, because even those few patients that I treated initially, where we really didn't have a big clinic set up, we didn't have the whole program, that really changed my perspective. And I thought, well, maybe this is something. And then, you know, from that really triggered my kind of joy out of that. It triggered my interest. And then I met a group of people who also were like-minded, and we were able to put together this clinic, which is grown into what it is today. So I'm very proud of that. And you're right. Like, did I need another job? No. But I do actually really, really enjoy it. And the days that I'm at my ketamine clinic, bring me a lot of happiness.
I love that. I love that for you too.
Thank you.
Yeah, that's awesome. And I share that in a way that's super genuine. Like, we work with a lot of clinicians and physicians, and you're right about the burnout, and there needs to be an opportunity for optimism and hope. And I'm happy that you've found that for you.
Thank you.
We're almost out of time. I totally didn't stick to my list because you've just been such a really interesting guest. But I kind of want to shift gears a little bit and ask you about your wealth. Not like financial wealth. Right. That would be awkward.
What kind of podcast is this?
No, but you know, how has your definition of health, like all of this is very interesting because you sort of bridge both sides, if you can call them sides. I'm hoping we get to a place where they're not like that. It's not like that anymore. But How has your understanding of health and healthcare changed?
Oh, it's changed profoundly.
Yeah.
I used to poo-poo a lot of these things as hokey, mindfulness, meditation. Oh, this is, nothing important and I don't need to do that. I am, in control. I know what I'm doing. I go to work. I'm totally type A personality, all those things. And then, yes, when the burnout kind of hit, I was like, oh, maybe I'm not doing things right. And so starting to embrace some of these other alternative modalities, as we call them, even though they're really not. And then because I am a science person, I actually looked at the evidence of that. And there is good evidence for these things. And so just even incorporating that in my own life, I've had my own health issues. I've had, lots of things. And before I used to be kind of upset at myself, like, why is my body betraying me? Or I can't do these things. I can't do this. I can't do that. And, being angry and frustrated. And now just completely changing that perspective and mindset and looking at things in a more positive way. Wow, look at what my body can do. This is amazing. Or, look at what I did today. I went out for a paddle and that was amazing. I have these opportunities to do these great things. And even just starting this ketamine clinic, look, I have these opportunities to follow these people and see these changes in their lives that are profound. It's really changed my perspective on what is important, what is brings you joy,
and maybe health.
And what is health? And I think joy is part of health. And I think sometimes we get lost in medicine just because we are, it's the daily grind, it's the grunt of it, it's the day to day you get down on yourself, you get down on kind of everything. When you're burnt out, you have no empathy left for anybody. And I was at that point and really changing my perspective and doing something completely different, way beyond and different than what I was doing before, has changed my perspective. And those things, I was always worried about being judged by my colleagues or judged by people. What is she doing? Maybe she can't hack it as an anesthesiologist and she's doing this other things now. Those things are meaningless. And I have really learned that I'm doing something that I think is amazing. I'm still doing my other job, which I love as well. But different things bring me joy now. So I'm not really that sort of daily grind. I don't really feel anymore because I have my, hands in doing different things every day. So every day is a new day to me because I'm doing different things each time. And then you don't really get sort of stuck in that rut anymore. And that's to me is health.
Yeah, I love that. And I totally agree. And I think sometimes too, at the opportunity to really work with people and see the impact, like you said, your work at the hospital is amazing. You love it, but you don't get to see, like, they don't come back and be like, hey,
yeah, look, I'm still alive.
Yay me. Yeah. Right. That is profound, that human connection. I think that we all really, really desire. And it's so important. We spend so much time working, right? Like, so to be able to cultivate that is huge. But I love what you said too about just sort of like not resisting anymore, right? Like just like, there's all sorts of reasons to be like, oh, I'm resistant to that. I'm resistant to that. But just like the whole idea of ketamine, like metaphorically, I guess too, is like you're opening pathways, you're opening your mind, literally, right? Yeah. And so this conversation has been so great because, like, even for you personally, as I listen to you share, I can sense that happened for you too. Yes. Right? It was like,
without even having to take ketamine.
Yeah. I know. It's great though. And I hope that this conversation inspires other people. Just open your mind to the possibility that there are other ways of approaching health, regardless of whether it's your mental health or physical health or whatever, but that we have agency in that.
Yes.
Right? What areas of your health do you feel like wealthy or abundant?
Oh, that's such an interesting question. Well, I probably would say now that connection that I have with people, that those moments where I'm witnessing joy in other people's lives, that really brings me, I think that's a wealthy health.
Yes.
That's wealth and health. But it's even in my own life, I think, I have come to a place where I find joy and contentment in some of the more simple things. So, I brought up paddleboarding because it's one of my favorite things. And so for me, a morning meditation involves going out on my board for an hour by myself, nobody around. And that brings me so much joy, such that sort of, infiltrates the rest of my day and makes changes to things in that day that maybe it wouldn't have if I didn't do that. So personally, I feel like I'm at a place in my career where I'm established, I'm happy, I have a great family that's supportive, and it's those simple things that bring me a lot of joy and give me the health that I'm looking for, right? Like healthy doesn't necessarily mean like, oh, I run 6 marathons.
Or I don't have I'm not ill or nothing's broken. Yeah.
Right. So for me, it's just kind of being in this content state now where I have joy in my work again. I have joy in different things that I'm doing in my life, and happiness with my family and my dogs. And it seems to be sort of, we're in like a stable place.
Yeah. And it is a fine balance.
Yeah. And because, we've gone through years of chaos, we've come out of COVID, we've come out of, terrible illnesses and things like that. So it just kind of feels like we're finally getting to a point where, okay, everyone can take a breath.
Yeah. Well, that's a great place to pause and probably have you back, because it's just been so interesting. And I want to thank you on behalf of actually the patients and families that your work touches.
Thank you.
Because I am not a patient, but I am close to somebody who has been under your care through this clinic. And you are touching people's lives and having an amazing positive impact. And I don't know if you get to hear it. You probably get to hear it more than most physicians, but thank you.
Thank you
For the work that you're doing in our community and for people that are really struggling with some of the most difficult mental illnesses to treat.
Thank you. I hope we can help more people.
Thank you, Dr. Sanan.
Thanks.